everyone. Welcome to our latest Stanford Live. I'm really excited today. We have the APP Cardiovascular Health Department here today, to talk about their different opportunities, their department, why they love working at Stanford, and just kind of taking you on a little journey about what it's like to be part of their team. I want to introduce, to get started, the Director of Cardiovascular Health, Megan Atashru. She is here with her team, and I'm just going to kind of let her dive in and get started.
Thank you, Carly. Hi, everyone. Thank you so much for joining us today. My name is Megan Atashru, and I'm the Director of Advanced Practice for Cardiovascular Health here at Stanford Healthcare. I actually started my career as a nurse practitioner at Stanford as a new grad almost 8 years ago. And so it's been a terrific place for nurse practitioner growth for myself, and I'm excited for you to hear about our opportunities that we have today. We're going to spend most of the time hearing directly from the hiring managers and learn about their APP teams, but I wanted to first provide you with an overview of the department. The cardiovascular health service line is comprised of cardiology, cardiac surgery, and vascular surgery service lines, and we are extremely proud of the services, procedures, and the quality of care we provide for our patients. We've been recognized as best in the nation by many different organizations, and most recently, the U.S. News and World Report ranked us as number 9 in the nation for cardiovascular care. We are also proud to sponsor 2 transition to practice fellowship programs for APPs in CVH. We support a fellowship program in cardiac surgery and electrophysiology. And both of those were actually pioneer programs, first in the nation to be accredited by the ANCC with distinction. But we are more than these awards, and it takes the entire department collaborating together to earn these awards. And our APP team members are a crucial part of our success. They help us provide more access to patients, and their consistent presence on our teams positively impacts outcomes for our patients. In CVH, we currently have about 130 advanced practice providers. That's comprised of nurse practitioners, physician assistants, and clinical nurse specialists. Our APPs work in ambulatory, inpatient, and procedure areas, the cath lab and the operating room, across cardiology, vascular surgery, and cardiac surgery. We have APPs working at all of our locations in the network. So the majority are in Palo Alto, but we also have APPs working at Tri-Valley in Pleasanton, California, Emeryville, and in 2023, we will expand APP practice to the San Jose location. Our APPs practice at top of licensure, and we are proud to say that all of our APPs in CVH report directly to an APP leader. So our APP clinical teams are APP-led and supported, which is really exciting. It actually continues even up to our executive director, who is a doctorate of nursing practice. Within our department, our APPs have really rallied together to collaborate and generate a lot of APP-led and supported initiatives. So some of the examples are listed here. This is just a snapshot of some of the incredible work that our APP teams have pioneered, not just the lead APPs, but also the members on the team. We have a CVICU and a cardiology lecture series that's actually organized by our APP teams. They collaborate with other multidisciplinary team members to provide the lecture content, but it's something that has been organized by our team based on the learning needs of the different groups. For our APPs who work in the inpatient area who need to be trained on CV code, that's our open chest protocol, we have an APP-led CV code simulation training. And we also put all of our inpatient APPs through the central line placement training simulation, which is what all incoming residents go through at the hospital as well. The Department of CT Surgery has created an internal handbook that's sort of the how-to guide for caring for their patient population, and we're actually about to release the 3rd version of that. So really proud of the team for contributing different chapters and keeping that material up to date. And just wanted to point out that, this photo is one that makes me smile because there's many APPs here in CVH that have been with the department for a number of years. And the way that they've been able to create a career here at Stanford is by looking for internal opportunities for professional growth and cross coverage within the department. So they started maybe on the cardiac surgery AAU team, which you'll hear a little bit about later today. And then once they became a master in that area, they looked for the next opportunity within the department to continue to enhance and grow their clinical skill set. So we have some APPs here who have moved on to work in the operating room. Some APPs in this picture are working in really niche positions, multi-organ transplant, or supporting our Marfan clinic patient population. And so they've really found a way to continue to challenge themselves, bring their expertise with them as they stay within the department and within Stanford for the lifespan of their career. Another really amazing thing about Stanford is our Center for Advanced Practice. And I'm just going to call it a few of the programs here that they support, but definitely go on the website, search for Stanford Healthcare Center for Advanced Practice to get a better sense of everything that they provide and support for us. But some of the highlights are listed here. We have a monthly APP General Council that's led by APPs from the team. We do support a professional excellence program. So as APPs get acclimated in the environment, we do like to carve out time and support them in participating in either research or quality projects, process improvement work, if that's within their interest, and then something that's in alignment with our department goals. And then we have a really nice career ladder program. So this allows APPs to stay in clinical roles, and as they become more experienced, dabble in some of the professional programs that we offer and be promoted as they stay at the organization. But with that, I am going to hand it over to our recruiting teams to tell you more specifically about the teams, the role, and what they're looking for. So I will first hand it over to Sherry Miller, lead APP.
Hi, everyone. I'm Sherry. I am a PA for quite a few years, getting close to 30 years now. And I started in cardiac surgery and I'm still there. So currently I lead the OR outpatient team. And people usually are really curious about what a day in the life of our team looks like. And I like the combination of having OR and clinic rolled into the same group because we work up the patients as outpatient, do a pretty deep dive as we're working them up and get them ready for surgery. We take them to the operating room and then we see them back after surgery when they're wearing makeup and real clothes again. So it's kind of a fun full circle mix. And we usually have, one APP or sometimes more depending on the surgery in each surgery. And then we have some covering the clinic on any given day. But different people rotate through supporting different surgeons and different clinics. So there's some continuity built into the team, but we also have it built so there can be a lot of cross coverage in the operating room. And this is, I think, a great way for everyone to work on different skills, different types of surgeries, because a lot of us surgeons kind of have niche surgeries that they do a lot of. So by working with more than one, it gives us a lot of opportunity to grow. So as far as an ideal candidate for me would be someone who has a passion for the OR. It's clearly not a perfect fit for everyone, but some people just love it. So that's who I'm looking for. Someone who is technically sound, but also likes to get to know the patients and their families and is a really good clinician as well. So having that mix is what I'm looking for. Of course, we do a lot of different types of surgery, but one of the little surgeries that we do on our own is the endoscopic vein or endoscopic radial harvest. And both of those, I mean, anyone coming in with that kind of experience, that's a huge bonus. So I think that's all for me. I'm going to now introduce Tony Mendez. He leads the intensive care unit that we call J4. Tony?
Hello, everyone. I'm Tony Mendez. I'm the lead APP for the CVICU in the unit we call J4. That's me holding the balloons right above the cupcakes there. And I have been with Stanford since September 2018, where I was actually a part of the very first class of the CT Surgery APP fellowship here at Stanford. Did that for a year, and then worked with the MCS heart and lung transplant team for a number of months, and then transitioned into the lead role here on J4. And so the unit itself is a newer CVICU. That's we have two main CVICUs at Stanford. One is J2 and one is J4. J2 is run by a cardiac anesthesiologist, and what's unique about J4 is that it's actually run by the cardiac surgeons themselves. So the team itself is comprised of the cardiac surgeons who are our attendings, and also primarily APPs. So rather than have a model where we have medical residents rotating through, it's actually run primarily by APPs and the surgeons. So it's a very unique model and a very exciting opportunity for APPs to work directly with the surgeons. That made us number 9 in the nation, which is pretty cool. And we started as a kind of a 4-bed kind of overflow from the main CVICU, and due to volume growth and expansion and just rapid skill expansion, we went from 4 beds to 6 beds to 8 beds, and now we're at 10 to 12 beds up on the unit, with a little bit of room to grow as well. And so I'm recruiting 2 to 3 positions right now. And it's a great opportunity to work with our surgeons, a great opportunity to work in the CVICU and recover just about any heart surgery case outside of ECMO and fresh transplant, and also a fresh LVAD. We'll take everything outside of that, which is great. And day in the life is really just you're the primary provider for 4 to 6 patients in the CVICU. So you're going to provide all systems care. You'll do a number of procedures. We do central lines, art lines, chest tube removal, pacing wire removal. We'll bronch people, do cardioversions, all sorts of really cool opportunities. And yeah, I mean, the ideal candidate is someone who's excited to be working in the CVICU, someone who's adaptable and flexible. Our services continues to grow, and we continue to kind of write the rules when it comes to running a CVICU with the surgeons themselves, which is a lot of fun. You get to actually work hand in hand with them. And yeah, so someone who's adaptable, flexible, team player, and someone who's excited to join. So that's what I got. And with that, I will hand it off to Scarlett, who's a lead APP in our AAU team.
Hi, everyone. My name is Scarlett. I am the lead APP for our cardiac surgery AAU unit. I've been at Stanford for 15 years now. I started out as a nursing assistant, and then I got my first new grad nursing role on the intermediate intensive care unit, where I still currently work. After 5 years of nursing, I decided to go back to graduate school, and from there, I joined the cardiac surgery team. After completing my postmaster's ACMP from the university, from UCSF. So I've been with this team for about 7 years now, and I've just recently transitioned into the leadership role a few months ago. So a description of our team is we are the cardiac surgery team for the AAU. AAU stands for the Acuity Adaptable Unit, which just means they function both as a med-surg and at the intermediate level. We care for the patients coming out of CVICU until discharge. We are also in charge of admitting patients from outside hospitals who are being worked up for cardiac surgery. And we do also serve as a consultation service for other teams in the hospital. Say a patient comes in and they're found to have coronary artery disease or valvular disease. We will get consulted and work up the patient and see if they are a surgical candidate. Our team is a 24/7 coverage team. We cover both day and night. On the daytime, we have about 3 APPs, hoping to transition to 4, and then 2 APPs at night. We work very closely with our integrated cardiac surgery residents as well as fellows, and of course, our cardiac surgery attendings. So, a day in the life of our team, we start at 6 a.m. That's when we pre-round and get the numbers on our patients. And then from there, we will round with our residents and do our own primary assessments on our patients. And after we round with the residents around 7 o'clock, they will go off to the OR, and then we function independently the rest of the day. We will then join 9 a.m. interdisciplinary rounds where we do discharge planning and patient care updates with the nursing staff, as well as case managers, PT and OT, and really just getting interdisciplinary updated care for our patients. After that is done, we do our progress notes, and then any procedures. We do chest tube removal, pacing wire removal, cardio versions on our own, and then we also provide wound care for our patients. Our night shift APPs, we will directly sign out to our night shift APPs at around 6 p.m., and then they will care for our patients for the rest of the night. And then our ideal candidate is someone that is excited to work and thrives in a fast-paced, team-based model. We do welcome new graduates. I myself was a new graduate, and we have hired actually 5 new graduates onto our team in the past year and a half, and they have done really well. We actually are hoping that a candidate would have basic surgical and basic medical decision-making skills. If you do have a surgical background, it's a big plus, but it's not always required. And you just have to be excited to learn and be passionate about what you're doing. We do offer 6 to 12 weeks of orientation, and then which is one-to-one preceptorship and mentoring if needed. With that said, I will pass it along to Joe Simmons, who is our lead APP for the cardiac surgery transplant team.
Hi, everyone. Nice to have everyone, and nice to be introducing my wonderful team to you guys. So I've been a nurse practitioner for 10 years. I started at Stanford in the cardiac surgery team, and I've had the opportunity to lead the surgery, heart and lung transplant and MCS team for the last 2 years. And it's been a great experience. This team is very, very knowledgeable, and they're very easy to lead. They're very independent and autonomous in their care, and we see mainly the index patients. So the patients that come in for their initial heart transplantation or their lung transplantation or their left ventricular assist device implantation. We also round on the extracorporeal membrane oxygenator patients that are in use of that machine. And we see the patients in the ICU as a consulting service. We work very closely with the residents who manage these patients and offer suggestions and kind of guide the care, direct the care in the ICU. And then as they get better and improve, we become the primary team when they come to the floor. So we work with a cardiologist and pulmonologist to care for these patients on the floor. And we do many of the similar things that Scarlett just talked about with the wound care, the pulling the pacing wires, the cardioversions. Those are all done by our team on the floor. And we really get to know these patients because they end up staying with us for quite a long time. Most of our patients stay anywhere from 3 weeks to 3 or 4 months after transplant. It's a big deal. We don't end up seeing any of the patients that get readmitted, except unless they have a surgical issue. If they have a surgical issue, we'll either consult on them or be primary on them when they come back if they need to go back to surgery. And they've got an LVAD or had a transplant and now they're coming back. So who am I looking for in my team? I really want somebody who has transplant experience. However, we have had great success with a new grad that's just joined our team. She's in her 3rd month of orientation. I'm really a fan of lots of orientation, especially on this type of population. And if you're a new grad, you'll be very supported with my team because we want to make sure that you have what it takes, all the knowledge that you need to competently care for these patients before you come off of orientation. And I'm looking for somebody who's collaborative, somebody who enjoys working with other services and enjoys talking to other people and collaborating with other people about the care that they give, somebody who is knowledgeable or capable of attaining the knowledge that it's needed to become autonomous, because we do have situations where we will make the call to send a patient to the ICU on a 2 or 3 minute basis, and we have to be able to recognize those patients that are not doing so well and be able to get the interventions that those patients need in a quick amount of time. Somebody that's hardworking and somebody that likes to learn a lot, because it takes a real bright mind to be able to retain and attain all of the knowledge that it takes to care for this population. So I look forward to hearing from all of you, and hopefully I'll be able to work with some of you one day. With that, I'll turn it back over to Megan, who is going to talk about Mary Najedli's outpatient cardiology positions.
Thank you, Joe. So Mary Najedli is our lead APP for our cardiology team, and she can't be with us here today, but if she were, she would tell you that she has been at the organization for almost 20 years working as a nurse practitioner in cardiology. She has a wealth of knowledge, and she's been a fabulous teacher to her team. She's recruiting for 3 actually unique positions within her department, so I'll go through each 3 individually. The first is that we are looking for an APP to join our general cardiology team. This is an outpatient position in our cardiology clinic, and there are other APPs already in this role on this team. And our model is that all of the APPs on this team are trained to general cardiology patients, and then they're assigned a subspecialty in alignment with their supervising MD. So here at Stanford, we have faculty members who have specialties in women's heart health or sports cardiology, et cetera. And so they are trained to one of the subspecialties. They typically do just 1 shared session a week with their collaborating physician, but the majority of the APP's week is spent seeing cardiology patients independently. This could include both new patient visits and a lot of return patient visits as well. APPs on this team collaborate closely with their supervising physician. So typically, if the physician sees the new patient, they'll introduce them to the APP and tee up the patient to be seen for subsequent care by the advanced practice provider once the care plan is established. And if there's any changes in the care plan, that would trigger the APP to collaborate with or send the patient back to the physician. Some of the types of new patient visits that the APPs do see include evaluation, initial evaluation and diagnosis of chest pain, palpitations, dyspnea on exertion, syncope, edema. They also do a lot of preoperative visits or preoperative clearance, and they do complete the cardiovascular risk stratification scores and manage cardiovascular risk factors in general. This is a day in the life. So the typical sort of outpatient clinic schedule, they do a fair amount of virtual visits in our new world. So right now this team is doing 2 days in person and 1 day virtual. And there is some indirect patient care time built into their week as well. Somebody who would do well in this role, we have taken new grads on to this team, but really somebody who has a background or an interest, a strong foundation in medicine that really wants to go to the next level and specialize in cardiology. The next position that we're recruiting for on this team is for our structural heart team. So this team takes care of the majority of the patients are the TAVR patients. We have a very robust TAVR program here at Stanford, and also the MitraClip patients as well. And this team is cross-trained and cross-covers with our interventional cardiology team, so closely related for patients that are going to the cath lab for diagnostic or treatment cardiac catheterizations. And then the third position that we're recruiting for is an APP to work alongside an existing APP in our Echo lab, or our Echo APP. So this APP responsibility, this was actually a pioneer position for us about 2 years ago. We have a really experienced APP in the role right now who's really taken this on and shaped it very nicely, and it's been quite successful. And so we're expanding the coverage. The primary role of the APP in the Echo lab is to assess appropriateness of the prescribed echo procedure, assess medication hold, assess for GI or ENT issues, and then they obtain the consent, do the physical exam and the pre-procedure H&P, enter orders if necessary, and then supervise the test that's being administered. They work not only in the Echo lab, but also go to our inpatient areas as well if we need to do TEEs on inpatients, et cetera. So this is a very mobile position throughout the hospital. They're often going from the Echo lab, maybe down to the procedure unit, over to the floor to see all different types of patients and consults throughout the hospital. And with that, I will hand it over to Lori Henry, our lead APP in electrophysiology.
Hi, my name is Lori Henry, and I'm the lead inpatient APP for our EP service. I've been here with Stanford EP for about going on 7.5 years. And just a shout out to everybody on this call of the leads and the people that have worked here. As you can see, it's a nice place to work and people stay a long time. I think that's been apparent as there's been, everybody's been here quite a while. Says a lot about the environment and the culture here at Stanford for APPs. So our day-to-day life as an EP APP, there's 4 different roles that we're filling at the moment. We are filling, one person is the inpatient role, a designated inpatient person, and that APP will manage the inpatient service, any admissions that come onto the service, and do any of the discharges. Then we have a cardioversion APP. So we independently do all of our own cardioversions with or without TE. We use great help with the Echo team to do the TEs. And so we manage all the inpatient and outpatient cardioversions. The third role is the device pager, which I'm carrying today. So from 7A to 7P, I carry the device pager and will fulfill any requests for device interrogations on the inpatient side. And then the newest role that we have, which is about 2 years old, is our lab APP. And so that APP will consent patients prior to procedure, will go into the lab, go into the procedure and get access, close the pocket, et cetera. And then also help to manage those patients post-procedure where they're still in PACU. We have a growing team, and what we're looking for is someone that has some EP experience, which typically is not easy to find, but cardiology experience would be great. EP has it's multifaceted. It's the arrhythmia side, and then you also have the device side, and the device training takes quite a long time to learn. We provide a lot of orientation. Our orientation lasts longer than most. The inpatient, the cardioversion, those can be shorter orientations, but our device orientation with a lot of support typically takes up to a year. And so we're looking for someone that would be interested in learning devices, learning all the facets of EP. It's a great team. We have wonderful physicians, someone that hardworking and would want to come into a really good APP culture. And now I'm going to introduce Ani from Vascular.
Hi everyone, my name is Ani Bagdasarian. I'm the manager of advanced practice for vascular surgery. We have 3 locations for vascular surgery here at Stanford. It's Palo Alto, Emeryville, and Pleasanton. I've been here, I'm a nurse practitioner. I've been here for about 10 years or so. My first NP job was with vascular surgery. I was an inpatient NP and then transitioned to lead and then manager. And I love our vascular surgery team and our patients. And so the team in the East Bay, which is Pleasanton and Emeryville, is slightly different than the other positions that you've heard about today because it's not necessarily an academic site. It's a community hospital called Valley Care in Pleasanton. And so there isn't a huge reliance on trainees. So the day in the life there is the APPs and the physicians work very closely together on all aspects of patient care, the inpatient, the outpatient, and in the OR. So the day in the life for our 3 APPs who are there currently is a combination of everything. On clinic days, there's an APP in clinic. Every day of the week, there is someone doing inpatient care, consults, admits, discharges. It's a day shift in the current state. And then, of course, scrubbing the cases. Vascular surgery is a combination of OR and cath lab cases. And so those are the types of cases that our APPs support operatively. The team has 2 surgeons in the East Bay. Both are Stanford faculty, but work at those sites. And so they do go to clinic in Emeryville and in Pleasanton. They're about 45 minutes away from each other, but it's never both places on the same day. And the hospital is based in Pleasanton. And the patients have the same type of medical record as they do here in Palo Alto, can be transferred back and forth between hospitals for any necessary needs. What we're looking for this position is someone with some independence at this point in their career for an APP. So at least 3 years of APP specialty practice in a cardiovascular surgical specialty, or a general surgery specialty would be good as well. There are a couple laparoscopic types of surgeries, so any experience with that. Sometimes IR is something that we can, consider depending on what kind of support what that role was that you had in your experience, and some inpatient experience as well. As I mentioned, there's no trainees there, so there is, top of licensure is definitely appreciated every day in this role. You will be first responding to the patients on the floor and in the ICU. In taking care of patients in the pre-op area and in the PACU and in the OR. So you really get the whole, continuity of care from a pre-op patient to a post-op. And then in vascular surgery, we see patients for surveillance forever. So we see those patients in clinic at 3 months, at 6 months, and in 1 year, and lifelong. So yeah, if you have any other questions, please let me know.
Sorry, I was muted. Hopping in, I've just been keeping track, and now we're kind of going over the application process. So Megan, if you don't mind, I was going to hand it over to Rick, kind of let him walk through our application process, interview process, kind of what to expect as you look at potentially joining us here at Stanford. So Rick, don't be like me, unmute yourself, and it's all you.
Oh, Carly, I strive to always be like you. Hello, everyone. My name is Rick Novak, Senior Talent Acquisition Representative here at Stanford Healthcare, and wanted to kind of walk through just really quickly some of the most common questions that we get as recruiters here, and give you kind of an understanding of what happens when you apply for one of these awesome positions that these managers have been talking about. So first off, make sure that you go to our website. It's careers.stanfordhealthcare.org. And I think we're going to be able to share that on the screen here in a moment. And then also, you can actually, I just drew a blank on what that's called, and I'm a millennial. You can use your camera and actually scan that QR code, and it'll take you to our career site. Also, make sure that you follow those 2 Instagrams at the bottom, because we do use our social media a lot to post not necessarily positions, but kind of more about our culture and individuals that you saw today in all the great pictures. So once you go to the website and actually apply, the first thing that you want to do is create what we call a talent profile. That's going to do a couple of things. Honestly, most importantly, that's going to give you access to job alerts. So you'll be able to upload your CV and put in some keywords for positions that are really interesting to you, even if there isn't something open now, or even if you're not ready to interview for a position, like you're in your master's program, or maybe you're not totally ready to commit to a move. Still go upload your resume and create a profile. We're not going to call you and harass you. It's all done virtually. So you can see as those positions come open from this department and others. Once you actually apply, first thing I want to say, don't go hog wild and apply for 30 different positions. Number one, we can see that. And number two, it just gets really confusing for you. Okay, so what we'll do is generally recommend apply to 3 to maybe 5 positions that you feel are really interesting. Now, in all candor, we are going to take a look at your application and your CV and make sure that you're a fit for some of the job parameters. Okay, so if you are a fit for one of the positions you've applied for, myself or one of my colleagues in talent acquisition, the recruiters, we will actually reach out one-on-one and set up a time to talk to you on the phone. We're going to give you about a 5,000-foot flyover view of the actual position, and we'll give you all the information on benefits, compensation, HR processes, really anything that you need to know about being an employee here at Stanford Healthcare. At that point, we'll work with you to coordinate some time to actually speak with one of these wonderful leaders as well as some of their team members. Couple of things about interviews real quick. Number one, we're really doing everything virtually right now. We've gotten really good because of the last couple of years we've had to, and we do typically make offers based on a virtual interview. If you do not live close to the Bay and you would need to fly in for an interview, please understand all travel and accommodations for an interview are your responsibility, and we do not reimburse for those. Okay, but again, we have a very thorough kind of virtual process where you will typically talk to one of these leaders as well as some of their team members, and in many instances, even be able to interact with some of the physicians on the team that you'd be working with. Once the interview is complete, then we'll actually have a conversation about the next steps, and we'll deliver a verbal offer to you. We'll go through compensation. We'll remind you of all the processes that we've talked about, and then you have a decision to make. Should you accept the position? Number one, congratulations. Number two, that's just kind of the beginning of the process. You have about a 90 to 120 day credentialing process ahead of you. Our average is about 100 to 110 days right now. Understand that you're going to have a lot of folks that are there to help you with that process, especially if you're a new APP and have never been fully credentialed as an APP before. Myself and my colleagues and our wonderful colleagues in our med staff credentialing team, as well as your hiring leader, we are all going to work with you to make sure that you get through the process as quickly and as painlessly as possible. And then, great news, once you're through that, we've actually got an opportunity to talk about your start date and getting you onboarded. Somebody early mentioned that we do have a lot of formal training in the department. We also have a really, really good onboarding experience. It's about 3 days where you get to kind of know folks in different departments and divisions, a lot of questions answered, and a lot of opportunity to learn about our culture before you even start in the unit or team that you've accepted a position with. If you have any questions, my email address, and I can actually drop it in the chat here in a moment, is richardnovak@stanfordhealthcare.org. Feel free to reach out to me at any point in time. My colleague Elena also supports some of these leaders. She was unable to be here today. However, her and I work together very closely. And even if you apply for a position that might not be really the best fit, we will always take a look and potentially share your information with one of our recruiter colleagues to look at other opportunities for you, because we definitely want the best talented individuals to be able to come to our organization and really grow. So I look forward to seeing your applications and working with you throughout the process. And if you have any questions, feel free to put them into the chat, and have a great day. Carly, I think I'm kicking it back to you.
Thank you so much, Rick. I kind of wanted to take this time real quick, Megan. I appreciate your team coming here today and talking about the different opportunities in your departments, and kind of open this space up to you and your team as well. Are there any questions that you consistently hear that you're like, while I've got the audience, I just really want to, zone in on this one question that we constantly get? Or, we constantly get asked about new grad programs for APP, or, international visas, just all those different things that encompass, can they have experience in one specialty, move to another, ones that you just constantly hear? And I didn't know if maybe you or Sherry or Scarlett or Lori could kind of jump in and say, hey, here's how my department works, just to kind of knock out some of those FAQs per se.
Sure. Thanks, Carly. Yeah, I think those are really great questions. So as far as experience goes, of course, we always prefer somebody who has experience that is relevant to the role, but it's really varied and it really depends because everybody has such diverse backgrounds. And so, you might be a new grad PA to one of our teams, but if you have a background as a paramedic, it serves really nicely for the transition. So my recommendation is, we're all collaborating together with Rick and the other recruiters. And so get your application in for the position that you're most interested in. And if we think you might be a better fit on one of our other teams, we will get you to the right place. So maybe don't let the perfect experience trip you up too much, but just get your application in because Rick knows what we're looking for on the different teams and we can often collaborate together and get people to the right position. You do need a California license, so either a PA or a nurse practitioner license to proceed with credentialing here at Stanford Healthcare. So if that's something that, if you're really serious about moving to the state and you're in a position where you can go ahead and start that application, that might help move you through the credentialing process a little bit quicker if you were to come on board to the team. I think those are my comments. Does anybody else from my team have anything to add?
Hi, it's Scarlett with the Cardiac Surgery AAU team. So we actually hire a lot of new graduate APPs. We're very structured in our training program. Like I said, we hired 5 in the last year and they have all done really, really well. Me as a leader and Richard, my co-leader, we do one-to-one check-ins periodically throughout your orientation process and see where you are at. We also have like a competency packet that we go over and make sure you're hitting all the points that you need at that point in your orientation. So we do have a very structured process. And of course, everybody's always learning, but you're never alone on our team. So we always tell our new graduates, once you're done with orientation, it doesn't mean that you're left alone. Like I said, we always have 2 or 3 APPs working at one time. So don't be afraid to ask for help. And we are very collaborative and it's a great team-based unit and a team-based role. So we're excited to see who applies.
Hi, it's Ani Bagdasarian again. I wanted to also mention, even if you don't see a position that you would apply to, I think it's still a great idea to reach out to Rick or Elena and just with your resume and that you have an interest in a position here with CVH. And we're always creating new positions, if not now, maybe in 6 months, maybe in a year. Megan does a lot of strategic planning, both here and at all of our satellite sites. So if you do have an interest, please reach out.
And just to back up what Ani said, our group here at Stanford continues to grow. So even if we don't have a position, or maybe you don't have all of the qualifications you need to get in the door today, definitely keep checking because we keep growing and we keep looking for good people.
Thank you, Sherry. I think one more thing that I would add as I think about sort of like common questions that come up is often candidates who maybe are looking at positions in community settings, they look at our positions and they think that we might be too specialized or too segmented, and they don't want to get stuck only in ICU or only in one subspecialty for a while. And I just want to say that there's a reason why we have our team structured this way, because of the acuity and the complexity of the patients at Stanford Healthcare. This is really what has worked best, both for getting APPs onboarded to the role and, of course, as we're thinking about outcomes and the actual care that we provide our patients. But I would just sort of reiterate thinking about how you can make a career at Stanford by taking your experience on one team and moving to another internal team within the department, if that's something that you have an interest in. So instead of thinking about doing every single type of role or in every single specialty or every single type of arena where we practice, thinking about segmenting those things out over a much longer period of time, which I think in the end has worked really, really nicely for professional growth and satisfaction of our team members.
Megan, thank you so much for kind of wrapping this hour up with that. I appreciate all of you guys joining us today. For everyone out there that's been watching us on YouTube, LinkedIn, thanks for joining us today. If you check within our chat here on our platforms, Megan's been answering your questions. Feel free to directly reach out to her as well on LinkedIn, and she'll happily connect you with her different colleagues. We will also post a picture of that link with that QR code that lists off all the different requisitions that we currently have available within cardiovascular APP. And Rick, of course, is also, going to hop in, put his contact information in there, and be available to answer any questions that you might have. But again, appreciate everyone joining us today, and we hope you have a great rest of your Wednesday.
Thank you.